I'm Professor David Hunter from the University of Sydney and Royal North Shore Hospital in Sydney in Australia, and I'm primarily focused on osteoarthritis clinical research. Our primary focus is on trying to remedy the lack of effective treatments for people living with osteoarthritis. That's always taken a very broad-based approach from the perspective of both doing epidemiologic research, so looking at reasons why people develop osteoarthritis, why they develop pain. We do quite a lot of biomarker discovery research, particularly focused on imaging research to try to better understand what structures change in the context of osteoarthritis. At any one time, we'll be typically doing about 8 to 10 clinical trials, and they range from looking at lifestyle behavioural interventions, so exercise, weight loss. We have at the moment a prevention trial focused on preventing the development of osteoarthritis. We also have a strong focus on testing disease-modifying therapies. So these are therapies designed to promote both symptom relief and improve the underlying structure of the joint. And in addition, we also do quite a lot of what we call health services research, so looking at the way healthcare is delivered for a disease that currently most people receive inappropriate care, and we're trying to really improve the evidence practice gap and make sure appropriate care is given to people living with osteoarthritis.
Hi, I'm Dr. Bincy Thampi, the Medical and Scientific Affairs Lead for Australia and New Zealand at Haleon. So Haleon is one of the world's leading consumer healthcare company with a diverse product portfolio, which spans across 5 major categories. We have products in pain relief, in oral health, digestive, respiratory, vitamins, minerals, and supplements. And my role, being a part of the Medical and Scientific Affairs function, so our primary role is to lead evidence generation and to foster external research partnership for the organization. Now, this work is quite essential, and it's crucial because it aligns to our core mission, which is delivering better everyday health with humanity. And this also ensures that our products are backed by robust scientific research and innovation. Now, our research commitment extends beyond Australia. We also have active research partnerships in the US, the UK, Singapore, as well as China. We are quite passionate about leveraging the scientific research to develop products that truly make a difference to people's lives.
So as a researcher and a clinician, we've been very interested in osteoarthritis, and as an industry body, Haleon similarly has a strong interest in osteoarthritis. A lot of that interest is shared, so they have products that potentially could help people living with osteoarthritis, and a lot of our patients are taking products that Haleon sells over the counter to help with pain and stiffness related to osteoarthritis. So through that shared interest and the mutual desire to develop treatments and an evidence base around particularly the use of supplements in the context of osteoarthritis, we developed a partnership to try to support ongoing evidence development for people living with osteoarthritis around the evidence-based use of supplements in the context of osteoarthritis.
We saw a significant unmet need for evidence-based research in dietary supplements for osteoarthritis. Now, osteoarthritis is a debilitating condition that affects over 2 million Australians and 595 million people globally. Now, the University of Sydney, with its rich heritage, coupled with the expertise of Professor David Hunter, who is a world-renowned osteoarthritis expert, is the ideal partner for this initiative. Now, the university is globally renowned for its research excellence, and Professor David Hunter is known for his extensive clinical work as well as research in improving the lives of patients living with osteoarthritis. And a few years ago, Professor Hunter and his team published a meta-analysis on the efficacy and safety of various nutritional supplements for osteoarthritis. So his work in the supplement space was quite inspiring for us because it was very well aligned to our commitment of deep human understanding and trusted science. And now, beyond osteoarthritis, our broader aspiration is really to enhance mobility health. So we're also looking into digital health technologies that can enhance mobility and also work very well with our products to improve the self-care for our consumers. Professor Hunter's passion in all these areas makes him truly an invaluable partner in our mission to better everyday health and underscores our shared focus in these areas. This funding is for a 5-year fellowship, where we are funding for the postdoctoral fellow, who will be working very closely with Professor David Hunter in this research partnership. We're still in the early stages of this 5-year fellowship, but we do have some exciting milestones and data reads ahead. As global leaders in pain management and everyday health, we do aspire to advance the science of dietary supplements within osteoarthritis. Currently, if we look at the evidence of dietary supplements in such conditions, it's not robust enough. And the aim of this research partnership is to strengthen this quality of evidence in this area. We also hope that the findings from this research will help us accelerate and enhance the mobility health literacy and further inform on Haleon's product development pipeline. At the end of the day, we just want to give our consumers meaningful solutions that better their health outcomes.
The partnership with Haleon is focused on improving management strategies for people living with osteoarthritis. There's a particular focus on looking at developing new supplements and testing the use of supplements in the context of osteoarthritis so that people can have a better evidence base and choice about the use of supplements that they have for osteoarthritis. In addition, a lot of people that have osteoarthritis also have problems with mobility, and so we're actually developing new methods of assessing mobility that potentially could be used to assess to see whether the disease is having a particular impact on disability and mobility in people living with osteoarthritis. In addition, we're also hopefully going to test and develop new evidence around the microbiome and its role in the context of osteoarthritis. The relationship with industry and academia is critical, and we've been incredibly successful in developing partnerships with lots of industry bodies to help foster the development of new treatments for people living, at least in my context, with osteoarthritis. We know that from a research and development context, about 75% of funding that goes into research and development for diseases including osteoarthritis comes from industry. And so I think it's critical that where possible, and particularly where there's a mutual shared interest, we foster relationships and collaboration to further pursue and not necessarily duplicate research where there can be that mutual benefit. We strongly believe that academic industry collaboration is vital both for industry but also for the development of products that are likely to be focused on improving disability and care for the patient population that we're cared about that is living with osteoarthritis.